I'm Dr. Khan from Harley Street Skin Clinic, and today I want to talk about the lower face, the neck, and the mid and upper face. I've been working with a technology called FaceTite and NeckTite since 2009, and we see fantastic results in the right patients, of course. So what's the main difference between FaceTite, NeckTite, and a surgical facelift? Well, they're both surgical procedures. One is an intermediate procedure where we're going under the skin, we're using energy to heat up and to remodel the tissues, which results in tightening, lifting. We can also access the fat layers where there's excess fat. We can reduce that by doing microliposuction. Whereas a facelift, a full cutting facelift, requires cutting into the tissues, repositioning the deeper tissues, lifting and tightening them, and cutting away excess tissues. Now, who's the most suitable person for each? Well, when we consider the face and neck tight, it's not going to give you the same degree of lift as a cutting facelift is, which means that it's more suitable for somebody who is just starting to see the aging process, starting to get slight reduction in the volume, slackness, and dropping of the face. And what we can do is with those people, we can get phenomenal results. And don't forget, we need to combine that sometimes with skincare as well, because the skin is changing. So we combine it with Morpheus 8 or other energy-based treatments for the skin. Now, it's also suitable for much younger patients who have excess fat, and they have anatomical features where they've got a double chin, they've got heavy jowl, they've got buccal fat pads. Previously, buccal fat pads were taken out from within the mouth, and it's a structural fat pad which holds up the tissues. The problem with that generally was that once you take that structure away, that the skin and the tissues can drop. So though people were losing that chubbiness, they were looking a bit older, and over the years their faces would drop sooner than they would have done. Now, when we combine it with FaceTite, what we find is that in remodeling the tissues, we're actually tightening up and contracting the tissues, so we don't get that sort of side effect. And people are finding that they get much better effects, which are much longer lasting. So it doesn't accelerate the aging process, and it actually makes them look a lot younger and a lot more shaped in their features. The other thing is tightening up the jawline. When we have excess fat of the lower face and of the neck, particularly here and also here, that obscures the jawline. And what we're seeing is phenomenal results with face and neck tight and liposuction in those areas, particularly in younger people. So young people up to mid-aged people in their 50s and some even in their 60s if the features are right. However, as we age, then we slowly transit from non-surgical to intermediate surgery, which is face and neck tight, through to full-on surgery. This is most appropriate in people who've got a significant drop in their face, lots of lines and wrinkles, thinning of the skin, and that's the only treatment that's going to give them the results. Now, sometimes face and neck tight can be used in combination with a face and neck lift to improve the quality of the skin, to tighten the skin further and give them a much younger outcome. So a lot of people ask me about the invasiveness difference between face and neck tight and a full surgical facelift. Now, a face and neck tight is working in the surgical plane. It is a surgical procedure because we also do liposuction. However, most of the energy and most of the work is done above the actual muscular layer and the SMAS, which is the connective tissue between the muscle and the soft connective tissue more superficially. Now, in doing so, we can tighten things up, we can lift things, and we can get great results. However, a proper cutting facelift, if it's a superficial facelift, it's in the same plane because all we're doing is cutting out tissue, reducing fat, and lifting the skin. However, a deep plane facelift works much deeper, and this is possibly a better option for a lot of people because it restructures the whole layered structure of the face, the 5 different layers. It addresses the deeper muscles, the tendons, the ligaments, as well as the fat pads and the skin. So a deep plane facelift is much more invasive and deeper. Also, all facelifts, cutting facelifts, are more aggressive, if you like, because we're excising tissue, we're cutting tissue away, we're sewing things up, and the scarring is much greater after a facelift. Even though it is strategically placed around the ears, the scars are much bigger, whereas the scarring from a face and neck tight are much smaller, less than half a centimetre, usually placed in the creases here and here, where the ears join the face, and also down here, where there is a little crease just under the chin, which gives access to all of these areas that we're working. If we're working mid-face and upper face, again from here we can access the mid-face, and the upper face and the brow we normally access with Accutite, which is a much smaller probe, and we access that through tiny little needle puncture holes. So the incisions and the scarring is much less. Also, the recovery is less, obviously, with a face and neck tight. I would still allow 5 to 10 days of swelling and then 2 weeks overall in the downtime, after which you're going to be looking quite good. Whereas with a proper cutting facelift, you're going to have the scars that are going to be healing. You're going to have your stitches out at about 10 days to 2 weeks. And what you'll find is that the tissues are going to settle, and it's going to take a bit longer for them to settle. The risk profile also is greater when you do greater cutting. You have tissues that have to heal together. So the risk of tissue breakdown, the risk of infection is also higher. It's really important to prepare yourself for any surgery. I personally would not carry out any kind of surgery on anybody who's smoking, because that significantly increases the risk of infection by about 7 times, and also tissue breakdown and poor healing of the scars by a significant amount. So it's really important to listen to your surgeons, to follow the preoperative preparation and also the post-operative care. People also ask about the longevity of the effect. Now, obviously, when you do a deep plane cutting, facelift and neck lift, you're repositioning the tissues. That's a permanent repositioning. It will change with age. So the longevity of the procedure, is it permanent? Yes, any surgical procedure makes permanent changes. But what's the longevity of the effect? That's a different question, because the longevity of the initial effect is only related to the aging process, because as we age, things will change. So with the face and neck tight, we see a benefit over 10 years or so. And I've had patients who came back after about 13, 14 years to come back and see me to have more work done with a face and neck tight. With a face and neck lift, similar sort of times, because it's not the procedure that's starting to fail. It's actually the aging process that's changed the way that your skin is hanging, that your tissues are, the health of the tissues and the tightness. And usually when people come back, we look at them, assess them, and decide whether a small tweak is required or whether a revision of the surgery is required. And that's very much based on an individual basis, depending on individual needs. What a lot of people ask is, well, who's the ideal candidate for face and neck tight, and who's the ideal candidate for a face and neck lift? Well, that depends again on a number of factors. Number one is your personal requirements and expectations. If somebody is looking to achieve a very predictable, very tight outcome, then surgery will give you that much more than a face and neck tight. But if somebody's looking for a very natural and again a significant improvement according to their own physiology and their own features, then face and neck tight would be good. However, other factors do come into it. The degree of lift we're looking for, the degree of repositioning we're looking for. Surgery will give you a greater degree, which means that people who are older, who've got much more skin hanging down, and people come to me and they say, I don't want surgery, I want something that's non-surgical, but I want this kind of result. Then if only surgery will give them that, that's the only thing we can do for them. However, there are people who absolutely do not want surgery, but want some degree of improvement. And if we can assess them and we can communicate with them the degree of improvement they'll get, and they're happy with that, then they'll be happy with the outcomes, of a less aggressive procedure. So, who's the right candidate? Well, anybody who has the right features, the right expectations, and are open to the results they're going to get with that particular procedure, they're the right candidates. In some patients, the best results are achieved when we combine a face and neck lift and then the FaceTite, neck tight, skin tight, Morpheus8 procedures. Because what we're doing is we're addressing different aspects of the aging process, where the deep plane face and neck lift will address the deeper structures, coming back, reassessing, and then doing a face and neck tight to address any laxity of the skin, any chrono or photo aging of the skin on the surface. We can then get a much better result by coming back and doing a secondary procedure with the face neck tight and the Morpheus8. At the Harley Street Skin Clinic, we have an integrated team of specialists working together. We have surgeons, we have intermediate surgeons, we have non-surgical cosmetic physicians. Now, the beauty of providing that sort of service for us and for our patients is that we don't have to push one particular procedure. These procedures are not mutually exclusive. One procedure is not necessarily better than the other, and sometimes a combination of these procedures is the right thing for you. So by having access to these, we can sit with you, look at you, listen to your needs and your expectations, and then come to a decision together as to what the right procedure or combination of procedures is going to be for you.